Welcome to the Center Collaborative, Creative Solutions in Behavioral Health and Criminal Justice, brought to you by the Oregon Center on Behavioral Health and Justice Integration, which is also known as the Center. We at the Center are all about solutions. Our job in Oregon is to facilitate improvement of the system so behavioral health and criminal justice can work better together to engage people in treatment while promoting public safety. I am your host, Chris Thomas. I hold a master's degree in clinical psychology and have focused on the intersection between behavioral health and criminal justice for 20 years. Over 7 of those years were behind the walls of a maximum security prison. During this podcast, you will have the opportunity to sit in on real, in-depth conversations with experts about complex topics in a way that is both fascinating and digestible. We will focus not just on what is wrong with the system, but what is going right and how we can work together to evolve. Thank you for joining us for part 2 of our conversation with Captain Lee Eby, Clackamas County Jail Commander, and Galli Murray, Clackamas County Health, Housing, and Human Services Suicide Prevention Coordinator. We had so much to talk about regarding Clackamas County Jail's suicide prevention program that we ended up splitting our conversation into 2 episodes. The last episode, we talked about statistics, the planning process for program changes, and myths around suicide. We also started talking about some of the changes that they made to the program. In today's episode, we talk about more of the changes that Clackamas County put into place. Many of the changes did not impact the budget much, but were highly reliant on collaboration and communication between the jail and behavioral health. Through their collaboration, Clackamas County Jail and Behavioral Health were able to increase communication with adults in custody, make available a crisis line for adults in custody, increase communication with adults in custody's loved ones if they are concerned about them and who to contact, using a multimodal approach to rescreen, enhanced training for staff, and a new behavioral health discharge planner to coordinate continuity of care for adults in custody upon release. We also spend time talking about the importance of a robust staff wellness program. Their collaboration was able to make so many fantastic changes at Clackamas County Jail with minimal budgetary impact. I learned a lot during our conversation, and think you will too. Welcome to our conversation.
So, kind of circling back to our steps as we went through this process, and we ended up adding the Columbia risk assessment to our intake to, one, make sure we're doing a better job. While we didn't see many people that had committed suicide within that short period of time, the reality was we could have been missing something too. And so it was a better way for us to do it. But the other thing that came out during that process was we said, okay, we also know we have this 1435 day that we're seeing a lot of our attempts that are occurring. So what can we do to, again, be intentional, bridge that gap? And so what we talked about and we implemented was, let's rescreen people. But we got to do it in an intentional manner. And I say that in that one of the things that came up and was brought forward, and it was very robust discussion, was people who come into incarceration may not want to be totally open with law enforcement. They may not want to, when I'm sitting there with a badge and my uniform, want to say, I feel like killing myself, because they're worried or afraid of what might happen as a result. So we were trying, how do we get around that? That's difficult, right? Because that's our staff. That's who they are. So we thought, well, let's try another approach, was utilizing some of the technology we currently have in our facility. We were going to use our tablets that inmates possess and can use for communication purposes, electronic. We were using that for us to send a message to them saying, hey, we would like you to answer a couple of questions. And again, as Galli pointed out, the nice thing about the Columbia is it's very short. It's just a couple of questions. They say yes, then asks a few more. But it takes just a couple minutes. It's really just great. And so we would send that out electronically. It's voluntary. And a lot of people don't fill it out, don't complete it. But it gives us that opportunity to try that next step of rescreening individuals in custody at that 14-day mark and seeing what we can get back from them. And so we've done that. We actually implemented that. And we have seen people answer yes and go, yeah, I am feeling like that, or I have felt like that, where they may not have actually done it on intake and told us. And the nice thing, because it's all electronic, we immediately get emails and alerts telling us, hey, somebody filled this out. And when that happens, we immediately send mental health staff, go talk to them. And in one case, it was an individual marked yes, like probably within 30 minutes to an hour, was down in front of one of our mental health professionals. And her first response was, oh, I didn't even thought anybody read those. It's like, yeah, we read every one of them. And talked to her. Luckily she wasn't actively suicidal, but the thoughts had crossed her mind. And just talking to somebody, we may have averted an attempt or a completion. Those statistics you don't know. You can't say, well, how many did we save? You don't know that. But we know that we've had multiple people that have, after numerous days incarceration, and we try to get them before the 14th day, we've had them say yes. And okay, let's have somebody talk to you. And that might have been somebody that we've averted. So I think in that process came from, again, those meetings, that mapping. And while it may be difficult in some forms to say how successful it is, but I think when you look at the anecdotal data, you're saying, oh yeah, if you do 1, 2, 3 people, it's worth it.
It also speaks to what Captain Eby is saying, is that it's really hard to measure the effectiveness of prevention, which is why, we as a society focus a great deal on, we're very reactionary, right? But prevention is what saves lives. And prevention is oftentimes what we don't pay as much attention to as we need to, because we're busy doing our work. We're busy responding to the things. But it's kind of like parenting, right? It's like if you take a parenting class, or you do some things to help brush up on how to be maybe a better at your mom game, that in turn, it's maybe going to cost you some time and maybe some money, but in the long run, it's going to pay off. And so these things that the jail are doing that may sometimes take a little bit of time, but not really, they, in the end, are saving lives, they're saving time, and it's big.
Along that same thought process of trying to ensure that we are looking at the long game and not the short game is communication. And part of that was we developed a few things that not only we were hoping that they would get while incarcerated, but they would take with them. Every inmate that stays at the jail gets a brochure. It talks all about suicide. It talks about the myths. It talks about, what if you know about somebody in your block, or another adult in custody, what can you do? It gives you avenues of how can you talk to somebody. It gives you numbers. And this is one of the things that we developed that, again, I give credit to Galli and her team. We also put on there the Clackamas County crisis line, and they take that brochure when they leave, they can call. Well, as we discussed that, because again, we wanted that kind of ongoing, we're like, they're not going to talk to me. Maybe, it says talk to somebody, somebody in the jail. What if they don't want to talk to us? That's the thing we kept coming back to. And I had read in some other jails in Ohio and some others that had partnered, like we were doing with our mental health and behavioral health staff. I floated the idea to Galli of saying, hey, how do you feel about us allowing inmates freely, no cost, anytime, to call the crisis line from the jail? I wasn't sure the reaction I was going to get, because one, opening that up, I know Galli and their team in their crisis line, I'm sure they get a lot of people who just prank call and do that. I know it occurs, but you never know, and I don't want to be a burden to them by trying to fix or help work on something we're doing. And so I said, hey, what do you think of this idea? Her response immediately was, great, let's see if we can get this to work. Not like, let me think about this, or I don't know. It was let's see if we can get this to work. And I'm like, Wow. Okay. Yeah. Cool. And we have instituted it. They can call the crisis line anytime. They have access to phones in the jail. We post the crisis line number everywhere. We have posters all over the jail, getting that informational. We also, inmates in our facility, like many facilities, we have identification cards that they have to have, so that way when they're moving around, we know who they are. On the back of those identification cards, we put a whole bunch of numbers from the crisis line to other Clackamas County services. And we let them take that ID card, most of them want to, for ID purposes when they leave. So they can throw it in the wallet and here it is. Here's the crisis line if they have an issue. So we've instituted it. We've did training with the crisis line staff on how to contact the jail in the event that somebody contacts them and they're a serious risk, so that way we can do follow-up. We've talked about the problems, how we deal with that, and we've just basically opened that door. And to this point, we've had no problems, no backlash, no issues, no overburdensome of any system. And it also goes back to our original problem, which was how do we get individuals to talk outside of thinking, oh, they're talking to a cop. How do we do that? And so this was another option that we put on the table and were able to get working. So very, very successful. I'm very proud of that part of the program.
I love that Captain Eby raised that as like, hey, what could we try and do this? At first, it feels like this really monumental, like, wow, that would be incredible if we could actually make this happen. And come to find out, it's really easy to make happen. It's not complicated. I work for the county. We happen to operate our crisis line, which is 24/7, out of our county staffing and county programs. So, some people contract out their crisis line. We do not. We have it in-house. So that made it a lot easier. There were less kind of hoops to jump through. But, we consulted with attorneys around this, and we consulted with our HIPAA compliance officer because, there were lots of questions like, what about confidentiality? What about this? What about that? And, we got the green light on everything, and there were no modifications that needed to be made. Folks can just call, just like I can call or Captain Eby can call from the community. So that is something that is a really amazing, amazing thing. And, if I had my magic wand, it would be that any jail anywhere in the nation gives access to their inmates, gives access to a crisis line, so they can do the exact same thing that Clackamas County folks are getting.
This is a partnership. We are both taking on what we've talked about, that risk, but both willing to try to solve it. And this is one of those things where nobody's trying to shift burden to one or the other. We're together trying to help. And that's why it's made very successful. And as Galli mentioned, and I would agree, thought this was going to be a big lift. Oh, geez, it's going to be huge. Turned out not as heavy as we thought.
What a wonderful addition to your program. What I love as I'm hearing this is that you still have the front end screening like you always have. Then you 2 weeks later are screening through a different modality. So if people were really nervous saying, because sometimes it's really difficult to say yes when you're verbally being asked a question, but it's much easier when you're being asked electronically. You have that screening with a quick response. And then throughout that period, from when folks first get their ID and everything that they're seeing through the jail with the signage, they have access to the crisis line as yet another way to reach out. So there's so many layers of opportunities for communication and prevention and intervention. And the worry, I think, a lot of folks would have about adults in custody being able to call directly to a crisis line. But it sounds like that did not happen, that it was used quite appropriately and has been very successful part of the program.
Yeah, I would agree.
What were the questions that came up around HIPAA and CFR? Because that always comes up around these conversations. And how did you all navigate that? Could you speak to that a little bit?
Sure. Questions that came up were around the line being a recorded line. So when the general public calls our crisis line, that's a confidential call. we aren't going to be giving out information that John Smith called the crisis line for this particular issue because that's confidential. But when you're incarcerated and you're calling on a recorded line, it's not so confidential. Questions came up of like, well, do we ask the jail to use what they use when folks are speaking with their attorney and to not be recorded? How elaborate do we need to go? What are the steps we need to go to protect an inmate's confidentiality, and what rights do they have when it comes to these calls? What's from a liability perspective, et cetera. And what we learned in a nutshell is that inmates know that the line is being recorded. And so they can choose what they say or don't. And the crisis line staff knows that the line is being recorded. So both sides are aware and are kind of passively consenting by staying on the line that I'm on a recorded line. So I can share whatever I want, but it may be recorded. Those were the considerations that came up, at least on my end.
From the jail side of it, I have not as many concerns because HIPAA and CFR, there's a lot of corrections-related segments that allow us to share information for the safety of individuals in our care and custody. But we also wanted to be very, again, intentional with our relationship with Galli and her team and behavioral health. And we don't want to run roughshod and say, well, it doesn't affect us in the jail, so we don't care. So we went through a lot of discussions with a lot of people to make sure that we did this the right way. And the other thing, too, that speaking of communication, specifically with not just the inmates who know, and there's other things we did do with them, such as we also found in our research, we found a really great video that was produced by Missouri Department of Corrections. It's called Suicide is Forever. And it is a video produced by those incarcerated there who talk about their experience of suicide attempts. We use that video, we show it to all the individuals who stay in our custody, and it talks about, again, those myths, but it also talks about saying something, of stepping forward and not being ashamed. I can say that all day to somebody who's incarcerated in my jail, but they're going to look at me differently than maybe somebody who's been in their shoes. And so again, it's that communication and how do we get that across to them that we do care, and having somebody in similar situations saying, I've been there, I know what it's like, I think is really powerful to try to get a message. The other thing that came out in our discussions was, we're focusing obviously a lot on inside the jail risk, but there's a lot of things that occur outside the jail that affect us. And one of the things we started doing was changing messaging. And that was from creating a website on the sheriff's office page, specifically the jail page, about suicide. The jail page for Clackamas County, especially the inmate roster, is the most hit page on all Clackamas County websites. And so we know that there's a lot of traffic that comes through the jail sites. So why don't we take that opportunity, since it's there, to communicate? And so we created a pretty robust jail website that gives a lot of information. Also, if individuals are coming to visit, they'll see posters about suicide. We also did that when you call into the jail or you're having a conversation with an inmate, that we put in the message before they can even talk a message about that. We told them, quote, being in custody can be very stressful, creating anxiety due to the fear of unknown. Help us keep your loved ones safe. If an inmate shares thoughts of suicide or self-injury, immediately notify Clackamas County Jail at or jail medical professionals at, and we give them the numbers. Like, hey, they hear that every time they call. So, again, we're trying to bombard them with that information so that we can, because they're going to talk and maybe hear something different than we are. Well, tell us so we can deal with it. And that's, for us, a huge part of trying to continue that outside the jail mentality, that it's not just in our walls. This goes outside.
Again, another thing that was not a big lift on the jail, I think I can speak for Captain Eby, but changing the recorded message. When people call to talk to their loved one or their family member and they hear, if you have concerns, please do this. That is a brilliant idea that does not take any money, does not cost any time, and it does two things. It lets people know who are calling their loved ones or their family members who are incarcerated, lets them know that if they're concerned that this is what they should do. But it also, again, it signals to our community that we want to take care of the folks who are in our jail and that we need people's help. If they hear something, see something, that they need to say something. And so we can get people the help they need. It's a prevention strategy. And again, super proud of our jail for taking that step. And if I had my magic wand, all of our jails across the nation would have a similar line, because it really does make a difference. And people actually in the community are commenting on that. They will say, like, I don't know if you've called the jail recently, but they have this new recorded message. And maybe because it's a new message, people were noticing it. But what people were commenting on was the content of that message, that it's really cool that they're basically saying, if we're worried or we're concerned, that this is what we should do, which is really helpful.
Part of that also is a training component, training for my staff, training obviously for some staff, such as the crisis line staff, was training. And that's still ongoing. And we've done training with our staff about all these processes, including electronic processes where our jail management system comes up with alerts if somebody comes back in custody and they've attempted before, training on the screening process, and just suicide in general, but it's not done. We had plans to work with Galli's group to do some other training about persuasive talking and talking to people and how you do that. And we will get there once we're out of COVID. But again, you can't stop, and it has to be ongoing. And so while we set up this plan, and this has been almost a year in the making going through it, it's still not done. And I'm not sure that it may ever be done, but it's an ongoing process. There's no doubt about that.
Yeah, I think that this is something that we'll be tweaking for the rest of our careers. As long as Captain Eby and I are in our roles, we will continue to kind of modify depending on what's needed, depending on what the jail is seeing, and that we as a team will be responding accordingly. I want to go back to what Captain Eby said about training. So, Chris, you mentioned earlier that, people sometimes don't ask about suicide for a variety of reasons. And I mentioned that one of the reasons why people don't ask directly about thoughts of suicide or ask someone who clearly appears to be struggling if they're okay is that we just don't know what to do. That's where training comes in. And my understanding is that most jails across the nation are either requiring or maybe suggesting their staff to take web-based suicide prevention training or pre-recorded training that talks about suicide, and it's sit in front of a computer and you listen or you don't. And I don't know about you all, but when I have to take training that's been pre-recorded, especially on something that's such a heavy topic as suicide and complicated topic as suicide, I will admit I find myself multitasking. I'll have the video rolling and maybe I'll be responding to emails or what have you. So what Captain Eby is talking about is specifically a suicide prevention training that is actually evidence-based. So typically what our corrections officers get across the nation typically is they get a suicide prevention training that's been developed by typically not folks who work in the suicide prevention field and who don't know suicide in the way that maybe a suicidologist or someone who does this work more consistently would know. And although there are pros and cons of each, the training that I'm referring to, that Captain Eby is referring to, is called Question, Persuade, and Refer, or QPR. And it is literally an hour and a half long training, 90 minutes, that is an evidence-based suicide prevention training that focuses on what the risk factors are associated with suicide, and more importantly, how do you ask the question? So what we know is that if we give people the tools of how to ask the question, they will use it. And they will feel more competent and confident in how to have those conversations versus being avoidant because they don't know how to have those conversations, or they think that they're going to make it worse or whatever. Another thing that I really am just so proud of our jail leadership team taking on is making the commitment to train their folks in QPR. That's a big lift. And I think Captain Edie would say it requires taking people offline. It requires paying them for their time. And when you take people offline, then who's actually doing the work of working and caring for our inmates? So it's super complicated and it's a big lift. And again, like I mentioned before, that if we give people the prevention-oriented tools to better do this work and to be more intentional, they will use those tools and we will save lives. No doubt about it. No doubt about it. But that is a big lift and a big commitment and well worth it. I have one more thing that I think is really important that Captain Evie's team is doing in partnership with our team is that the relationship that happens between jail medical and our behavioral health team. The relationship is amazing, but jail medical plays a really big part in this work. And one of the things that we heard in these meetings from jail medical is that when someone comes into the jail, they're not there for very long typically. And if someone is experiencing mental health conditions, they either may not be connected to a mental health provider. They may have an existing mental health provider. And when I say mental health, it could be a therapist and or medication prescriber. But what ends up happening is that if we are working together, meaning if jail medical and our discharge planner are working together, what ends up happening is that jail medical can say, well, hey, John Smith is here and he says he is open to blankety blank agency in the community. What our discharge planners can do while the person is incarcerated is actually set up an appointment for a little bit far down the line, kind of, again, we don't know when the person's going to be exiting jail, but we can make a guess. And so rather than them having been incarcerated and maybe struggling with mental health stuff while they're in jail and then just being discharged and having to make that appointment for themselves, there's an appointment on the books. So for continuity of care, what the team is doing is making sure that if we know that an incarcerated individual has an existing mental health provider or even a physical health provider, that we are actually, when I say we, that the jail staff is actually talking to those providers. And, if allowable, talking to those providers and making sure that for continuity of care, that we are providing them the same medication regimen that they were on in the community, that we are scheduling them for an ongoing mental health appointment upon their discharge or release from jail. So that's an important piece of this as well, of when we're looking at, again, Captain Evie was talking about, this work goes far and beyond when people are released. In fact, we have our discharge planner is actually every single day, and I think this just started actually. So Captain Evie's talking about this work is still ongoing. I think this just started, maybe a couple months ago on our end. Is every single day our discharge planner looks at the jail roster, and because that's updated all the time, and then looks at the jail roster and then crosswalks people who are newly in jail and looks to see who their mental health provider is if we know that information. And again, primarily, for folks who are on Medicaid, our Oregon Health Plan, we may have that information. But if we know that they are open to, said agency when they come in through intake, we can coordinate care with jail medical, and jail medical can speak to their providers in the community, if allowable, so that we are taking even better care of folks who are incarcerated when it comes to their mental health and to their physical health. That's a big part of this work as well. And something that is, again, not a big lift, and something that is so helpful when we're looking at prevention.
I would add the discharge planner, which is extremely important, and I'm glad that we're discussing that because it's really a big part of the system. That discharge planner is a behavioral health employee, but works in the jail. So that relationship, meaning it's not like, okay, the jail walls where we hand off each other. It doesn't occur there. They're actually inside the jail either every day, or somebody from behavioral health is in there every day and communicating back and forth. And we have regular meetings that we do. We have this meeting called START about treatment and rehabilitation and discharge. And they talk about those with mental health. usually high acuity. But the reality is every day we're also dealing with individuals who are getting out who may not be of huge high acuity. However, there's an issue and we don't want it to get to a crisis. And so it's really making sure maybe they do have an appointment, or maybe in some cases we contact their provider, their mental health provider, and say, hey, you may not know this, but your client is here and we would like to set something up to make sure we're not missing anything. And that, I think that communication is extremely important and cannot be understated.
Yeah, we also, again, the partnership is, this is such a wonderful partnership, but, the county fortunately operates many physical healthcare clinics and behavioral healthcare clinics. And so if jail medical in Clackamas County Jail identifies someone who could use and who is wanting mental health care and who is wanting physical health care, the jail medical team can work with our discharge planner to actually schedule an appointment with one of our clinics and literally fast track that person into getting care, the day after they are released from our jail.
And in some cases, those individuals that maybe we can't get in the next day or maybe a week, we can work internally about ensuring that there's no break in their medications if that's part of the issue. And we will actually give them prescriptions or meds in hand, and the jail pays for that. Those people aren't just walking out the door with nothing. We want to make sure there's a safety net until they get to their next appointment.
I am so glad that you've brought that up, because this whole issue of discharge planning is one we talk a lot about. And it's complicated when you're talking about it within a jail environment versus when I worked for the department. We had a release date. Now, things could happen where that could move, but generally you have a release date. And so it's a very regimented process as far as timeline, right? You know when you need to start or when you need to start early. But within a jail environment, that is not the case a lot of the times. It's a bit more fluid than it is with DOC. And so I know that there has been some struggles around figuring out this discharge piece of it and follow up in the community and medication to fill that gap. As well as, I'm curious, as we're talking about this formulary. So I know, Captain Eby, this has been an ongoing conversation in Oregon about different formularies within jails and medications in the community or at the state hospital. And then that may not be on the formulary in the jail. I'm kind of curious about if that was taken into account with this discharge planning that you're doing with Clackamas County Health, Housing, and Human Services.
Our medical team and our formulary is very flexible. Our doctor and prescribers are very flexible because we want what's best for the patient, or in this case, the adult in custody. And so for us, it hasn't really been much of an issue. And if it's something that is problematic, and I can't think of an occasion that has, we would work with either the county health or outside providers to try to make sure that there is not that gap. So for us, it has not been an issue.
Very much a robust, systems-driven response informed by data with multiple layers. And so this makes me wonder if another jail wanted to look at a program like this. Budgets are tight. So what would a jail be looking at, a community be looking at, as far as what time and money to institute a program like this?
I think you can do it with very minimal budget impact. There will be some, again, depending upon the level of training, as Galli mentioned before. The training is can be very staff driven, obviously, and so that can be cost prohibitive in some cases. But the rest of it is really, it's about teamwork and using systems and resources we already have available in most counties and areas. Really, the biggest ask is you got to be open-minded to try something different. If they can do that, I guarantee you can make this work. Even when we first went into our first meeting, I'll be honest, there's some hesitation in my mind that we're going to be able to move anything or change anything big, because you're talking about that's a lot of parts. I mean, a lot of parts just in my system alone, much less asking the behavioral health system to be involved and say, hey, I need your parts too. But I will tell you, after that first meeting, there was no doubts in my mind anymore that we were going to be able to do something because everybody was on board. Didn't matter. Didn't matter what we were going to do. Everybody was on board, and we were all on the same path, which is how can we be better? And I think that really, if you can have a team that works together, I think you can do it for very minimal. I mean, because a lot of this is processes. Some of it, yes, pay for some brochures or things like that, but not expensive. Video, free. You can get it. Changing the screener's free. It's online. You can pull it off. Easy. The training's online. You can do it for the screener really easy. The website and stuff, hey, here's the deal. You can copy anything we did. It's free. Take it. Don't care. So some of that work's already been done, and I think you can implement it in that way. You have to understand your system and may change it a little bit and how that works. So I think it's very doable, and to the extent that I also think it's probably possible that somebody can do things better than we did, and then I would steal from them. That's how we would do it.
If so, we want to know about it so we can steal from them.
I'm going to send you my email address. Please send me anything you create. Because we're really not here to recreate, right? If it's out there, let me take it, right? And let me use it, because if it works, we're here to help each other. Suicide does not end at the county line.
Well, and I would also add, too, that suicide, because of the impact being so significant in our larger communities, that a suicide in our Clackamas County Jail could impact communities far, far away from Clackamas County in Oregon. We do a lot of work here in Clackamas County supporting people after they've experienced someone near to them from a loss from suicide. We do that in our community. And what we've known from doing that work is that one suicide that occurs here in Clackamas County literally has a ripple effect across the nation. You know, on the East Coast, we've called people as far away as Australia because someone who died here in our county from suicide had ties to someone in Australia. And so we reach out to those people because we know that the risk of suicide is significant for individuals who have experienced a suicide of someone near to them. And so to ride on the coattails of what Captain Eby was saying is that if we can all work together as a larger system of, and I'm not just talking Clackamas County, I'm talking like across the nation, if we could work together as different jails that are trying to embark on this work, that we would have a wider and safer network of support for caring for the people who are in our jails and our responsibility of caring for them while they are incarcerated, that it serves all of us to work together.
It serves us, and it also, I think, gives a better understanding for the public. Because when somebody dies in custody, there's a lot of blame. And there are times when the departments, the jails, and the counties, they do all they can and do, to the best of their ability to try to prevent these attempts and completions. Unfortunately, they do happen. And unfortunately, when we start doing the blame game and everybody starts pointing fingers, everybody becomes very defensive. And nobody wants to change. Because if I say I want to change, that means I'm admitting guilt that I did something wrong. Where we should be really pointing at how can I do it better? What is a better way? Somebody died in our custody. That is a horrible thing. Nobody wants that to happen again. How do we as a team can work to make sure it doesn't happen? And if it does, what can we do to try the next time to make sure it doesn't happen? And make it a rare, rare occurrence.
When we talk about the wider impact, it also makes me think of the rates of suicide within law enforcement, specifically with correctional officers. The rates are very, very high. And I'm wondering around having such frank conversations with staff around suicidality and seeing everywhere the crisis line where someone can call, because it's hard to talk about that, not only for adults in custody to talk about that with the folks that are caring for them, but for correctional officers to talk about that I'm having a hard time with everything going on, to have a place to do that isn't as scary. I'm wondering how that having these resources and these frank conversations are helping impact the staff wellness for officers at the jail.
I think it's one of those things that's very hard to get data on, right? What is the success of that? However, I will tell you part of our process also was making sure that when we have a suicide is that we also focus not only on the individual specifically and their family, but also staff who responded, having our peer support and EAP available and making sure that it's very well known that it's there. And by the way, it's okay to access it. But also, it's the same thing we give on a different level to the other inmates in the facility who may have been housed in that area, because there's an effect on them too. And so, we give them mental health counseling and stuff and follow-ups for them. So it's really looking at the system holistically. And as mentioned by Galli, one suicide impacts, statistic 100 people, right? I have easily over 100 people in my facility. It's probably that number for me is going to be much more than 100. So it's really important for us to know that it's not just impacts that, direct family of that individual, but it impacts so many other people, from the first responders, because the vast majority of those attempts, there's medical intervention going on right after it. And so when you're doing that medical intervention, you're having people try to intervene, and their thought process is, I'm here to save this person. With correctional staff, jail medical staff. And there is a point in those that are successful where those individuals are probably going to second guess themselves. Oh, I should have done CPR a little harder or a little longer. I should have done 3 breaths, not 4, And so there's going to be a lot of second guessing. And so we really need to take care of them, because we don't want them to be the next statistic. So a very robust peer and EAP program is really necessary. Overall wellness program is really necessary for employees. And I know in the county, we have a very good suicide prevention program, and it's very public, and including all the staff of the county, and Galli heads up, and you see a lot of the posters. You see Suicide Awareness Month. So it's in some ways in our face, and so that's good. That way people are thinking about it. And I think that's the first step.
Well, I know when you and I first started talking about this, Captain Eby, I was so impressed when I heard about the program that you and Galli had put together, and that most people hadn't heard about it. So I really wanted to highlight it today, because it is such a robust program. It's evidence-based. It is even looking outside in the community. It's multimodal, and it's using resources that you have at your fingertips. It's just using them in a slightly different way through your partnership. So it isn't something that's going to cost lots and lots of money when you're looking at budgets. And I really wanted people to hear about it. One, so we could have a conversation about suicidality and the impact that has both in a facility and for everyone that works within that facility and farther on. But also that sometimes it is such a complex topic and such an emotionally charged topic. It's hard for people to think about, talk about, and then look about what we're going to do to fix it. And you have done such a fantastic job at Clackamas County Jail and Clackamas County Health, Housing, and Human Services to coordinate together about how you're going to solve this problem. And it really be about rowing in the same boat versus fighting one another and blaming one another. Are there final thoughts for our listeners around what you would want them to know, either about suicidality or this program that we haven't covered?
I think the biggest, if there's a takeaway for us, is really be willing to step back and evaluate meaningfully your program, looking at the data, and be willing to reach across the table to partners to say, I need help. And then those partners hopefully will be as successful as we are and open to helping each other. And my honest belief is that I think that does and it will occur in most places. And again, helping each other is really where we try to improve.
I think I would add, as a kind of a takeaway, is that it's unfortunate when people become incarcerated. No one wants that. And we have an opportunity when people become incarcerated. And that opportunity is to ask people directly about thoughts of suicide, not only because the risk of suicide is high for people who are incarcerated, but because suicide is the 10th leading cause of death in the United States. Suicide kills so many people, and we don't talk about it. And so if we lived in a world where we were as intentional when we talk about suicide, when we ask people about suicide, if we were as intentional talking about suicide as we are about talking about our physical health, we would be in a very different place in this world. The suicide rate would go down. And so I see, as unfortunate as it is for people to be incarcerated, I see it as an opportunity to take the very crucial and very simple step of asking those people, are you having thoughts of suicide? Because if you are, we are here to be of support to you and to get you resources. And so you know that you're not alone.
I think that is a powerful final message for this podcast today. The importance of working together, looking at data, and being willing to look at ongoing improvement. And most importantly, being able to talk about this issue as frankly and as compassionately as we would if we were talking about cancer, if we were talking about any other physical issue. And we're just not able to do that in the society, but it's getting better. And part of that getting better is the work that you're doing in Clackamas County. So thank you so much, Captain Eby and Galli, for joining me today. I appreciate you giving me an opportunity to highlight the great work that you're doing together in Clackamas County. And hopefully we can continue to spread this work across Oregon, and other jail commanders hear about this and are able to look at this program. And I'm sure that you would be willing for folks, if they reached out to you, to answer any questions.
Absolutely.
Captain Eby, I'm seeing you nod.
Yeah, I really want to thank Galli for me kind of cold popping her and say, hey, can you come onto this podcast?
Galli, thank you so much. And it's a pleasure to meet you.
It's a pleasure to be here. I was super glad to meet you, Chris. And thanks for the invite, Captain Eby. You guys are doing great work, and happy to be a partner in the work that you all are doing. It's pretty amazing.
The Center Collaborative is a production of the Oregon Center on Behavioral Health and Justice Integration, a specialized division of Greater Oregon Behavioral Health Incorporated. It is produced by me, Chris Thomas, with production assistance from Patrick Kennedy. Music by Patrick Mulvihill and Patrick Kennedy. Subscribe to the Center Perspective using your favorite app. To learn more about criminal justice and behavioral health in Oregon, visit the Center's website at ocbhji.org. You can also find us on Facebook. We'd love to hear from you. Please reach out to us. Join us next time as we chat with the experts about programs and partnerships at work within this complex and yet compelling field.